Hey ClickSF, Brian Lynn here. This is part 2 of my talk on medical teaching, Feedback 101. In this part of the talk, we are going to talk about objective number 2, which is listing the characteristics of effective feedback. So when we think about giving feedback to our learners, there are 4 principles that I like to keep in mind. Effective feedback should be expected, specific, objective, and timely. Let's talk about what each of these things look like. So firstly, effective feedback has to be expected. What does that mean? Well, firstly, you should name it. I've got a word bubble here as I'm giving feedback to this learner. Think about the words you would use. Typically, I would say something as simple as, I am giving you feedback now. Because it's been shown that if you don't actually name it feedback, and you go back to that learner and ask them, did you get any feedback on that rotation? They're often going to say, no, I didn't. So you really want to make sure you're being explicit that you are giving them feedback. Secondly, you want to normalize it. Make sure that they understand that giving feedback is just something that you do at the end of every shift or the end of every week on rotation. One of our docs, Aaron Smith, who is a hospitalist here, calls it Feedback Fridays when you're on his service. So as long as the learner knows that it's something that they can expect, they're going to be ready for it. Finally, when it actually comes time to give that feedback, you got to be explicit to ask permission for it in the moment. Because even if you've named it, normalized it, prepared them that it's coming, there may be something that's occurred that day, that shift, maybe a bad patient interaction or something going on in their personal lives that just puts them in a mindset that's not ready to receive feedback. So make sure you ask permission to give feedback by saying something along the lines of, is this a good time for feedback? And if they respond that it's not, make sure that you table it and hold on to it for a time that is a better time for feedback and address what's going on with your learner in that moment. Effective feedback is also specific. What does that mean? Well, take these 2 cartoon characters. This one says, you are going south. Well, that's just information. If, on the other hand, the character says, you're going the wrong way, go back and take a left turn at the light. Well, that's information that is both much more specific, but also provides some direction and some suggestions for improvement. And as teachers in medicine, that is something that we're going for. Specificity, as well as direction, and when appropriate, suggestions for improvement. Effective feedback is objective. Now, this is the hardest of all of these characteristics of feedback to grasp, so let's spend a few minutes with it. Effective feedback is based on behaviors, not based on character. This is a photograph of myself working on teaching my 4-year-old son to read. Now, teaching him to read has been one of the joys of my life. I really love sitting, watching him, able to form words with them together for the first time. It's just a really cool process to see in action. But I always make it a point to let him know that I'm proud of him for getting that difficult word, or for being able to sound out the sound of those 2 letters together. Not saying, Elliot, you're the smartest guy in the world for reading that word, or I think you're a genius. Because if I praise his character when he gets something right, then what is he perceiving when he gets something wrong? I'm an idiot. I can't get anything right. So in the setting of teaching him, I always make sure that my praise is behavior-based, not character-based. And akin to this, you want to make sure that when you give feedback, you are using non-judgmental language. Let's give some examples of that. So here's some examples of some written feedback that was given about learners in the CLICK program. When you say someone is kind, thoughtful, smart, well, those are nice things to say, certainly. But if you think about it, that language is really judgmental. You're putting your opinion upon that person. It's better to really just say what they did. This student came to clinic prepared with extensive knowledge of social determinants of health to help solve barriers to patient adherence. You're showing the behavior, not placing a judgment. Further, here's a negative one. The student is disengaged, uninterested. Well, there's really no way that I can know what's going on in that student's head. Why don't I just say what happened? This student arrived late to clinic on several consecutive dates. Let someone else impose judgment about what that means. Finally, I could say the differential diagnosis was inadequate. That's my judgment of the differential diagnosis. But probably better would be to use this neutral language. The differential diagnosis for hemoptysis and weight loss did not include TB. That's specific, It provides direction as to what my expectations are for the learner, and it doesn't apply any kind of judgment upon the feedback that I'm giving. If you run into difficulty trying to think about how to make your feedback objective, fall back on these core competencies that we ask of all of our learners in medicine per the ACGME. Because if you fall back on the core competencies, it should be pretty easy to write and frame your narrative feedback in a way that makes sense and will help to show that you are in tune with the student's learning goals. Finally, effective feedback is timely. That means that you give it in the moment and your learner has the opportunity in real time to demonstrate improvement. Of course, this seems really obvious, but it's harder than it sounds, because in order to give timely feedback, you need to be ready to give it in the moment, right after that interaction or the occurrence. And to do that, that means you need to practice and rehearse in order to have appropriate language on hand that's going to really deliver the message well. It's also important that when you give feedback, when you got the opportunity, you follow up on that progress and show that you really care that they're meeting those learning goals. So again, principles of effective feedback: it's expected, specific, objective, and timely. And that does it for our objectives for the characteristics of effective feedback. Thanks, and I'll see you in part 3. Almost forgot. Want to do more reading on these topics? Well, here's a couple references that I'd suggest. The first is a classic article from JAMA in 1983 by Dr. Ende. He outlines really all the big issues related to the problems with giving feedback in medical education. There are also some really great workshops that I've attended at UCSF and Harvard, which talk more about effective feedback principles. Thanks.